Hello everyone, my name is Ismail Histopa. In this video, I will be presenting the Stakeholders Education Plan for my DNP project titled Implementation of Physical Activity and Diet as opposed to metformin therapy and preventing prediabetes and diabetes progression. For the sake of being more specific, the PICO of the DNP project is in individual age 35 and above with risk factors for diabetes and prediabetes, how can physical activity and diet, as opposed to metformin therapy, prevent the progression of prediabetes to diabetes within a 3-month period? The goal of this video is to discuss further how the collaboration with identified stakeholders is likely going to play out as the DNP project progresses. It is vital that the identified stakeholders are aware of what is or are going to be needed of them so that they could plan their participation accordingly. Wu, Wang, Tao, and Peng state that the incorporation of big data into the healthcare system led to the emergence of a number of stakeholders whose respective resource input and participation have varying effects on the delivery of care. Therefore, by identifying the most relevant stakeholders in one's DNP project, one is able to early on visualize in some extent the impact of his or her project in healthcare. I'm a firm believer in the fact that an idea for a DNP project is largely influenced by what we called as the caring experiences of a healthcare provider within his practice. I myself am a family nurse practitioner affiliated with CareMore Health, which is a subsidiary of Anthem Blue Cross and Blue Shield Insurance. My current patients, who are all enrolled in CareMore Health, reside in Burbank, Glendale, and also parts of Pasadena. Usually, I handle 60 to 70 assisted living and nursing home patients. Majority of my patients are diagnosed with type 2 diabetes, and this chronic disease is known to drastically impair one's quality of life if unmanaged. According to the Center for Disease Control and Prevention in the United States in the year 2022, it is estimated that 28.7 million people are diagnosed with diabetes, while 96 million people are diagnosed with pre-diabetes. It is also expected that there are millions who remain undiagnosed primarily because they struggle with the accessibility of healthcare services. For those who are diagnosed, they are immediately placed on an intervention that reinforces healthy behaviors. Of course, a healthcare provider must make into consideration the physical and psychosocial burdens that comes with diabetes or pre-diabetes and how this impact a patient's self-management, treatment adherence, and his or her overall quality of life. The development of a regimen is a collaborative effort between provider and patient. The patient must be open with regards to his or her living condition, or that the provider can best determine the most accessible and effective intervention for him or her. As is made clear in the title of my DNP project, the alternative intervention that aim to test is a combination of physical activity and diet. Specifically, the physical activity portion involves walking and several stretching techniques. As for the diet portion, it will be a low sugar and low caloric diet. While in the process of determining the structure of my intervention, I mainly took into consideration the affordability on the participants' part, especially with physical activity, as it is likely that there would be participants who would not follow through with the project should they be required to avail a gym membership or a specific equipment. The healthcare system has 4 major stakeholders, and they are the policymakers, patients, providers, and payers. Collectively, they are known as the 4 Ps. To begin, the policymakers are responsible for the development of a framework that oversees the provision of healthcare services to the public. They are reliant on the data coming from the rest of the stakeholders. They gather data is utilized in the development of population-level metrics, which are in turn consulted for matters concerning healthcare policies. Meanwhile, the patients encompass all stakeholders. After all, we avail the services of healthcare providers, and majority or are beneficiary clients of the payers. As for the providers, they ensure that the services they provide to the public are aligned with the policy framework established by the policymaker. Providers collaborate with one another in order to deliver comprehensive care. Lastly, are the payers who are responsible for the financial aspect of the policy framework. They avail healthcare services from the providers on behalf of their beneficiaries. Moreover, they monitor the economic feasibility of healthcare programs. For the DNP project in question, the most relevant stakeholders are the patients and the providers. This is because I will be introducing to the participants or patients an alternative intervention which may soon be adopted by other providers as well. Diabetes Self-Management Education, or DSME, lessen a patient's risk for diabetes-related complications. This is because DSME positively influences a patient's health literacy and self-efficacy. The DSME to be employed in the DNP project focuses specifically on the food intake and physical activity of the participants. To ensure adherence to the expectation of the project, DSME shall be conducted in every consultation. To reiterate, the most relevant stakeholders in the DNP project are the patients and the providers. The patients are, of course, the participants who will be required to follow the developed intervention for a specific period, like 3 months. Meanwhile, the providers will initially be singular, as it will be the one doing the bulk of interactions with the participants. Should the finding of the DNP project be satisfactory, then alternative intervention may be adopted by other providers and improved upon by further studies. This project is anchored on the Donavidian model by Avedis Donavidian. This theory has 3 major tenets: structure, process, and outcomes, which can be used to assess the quality of healthcare. Structure refers to the setting where healthcare occurs, and this includes the efficacy of healthcare providers, facilities, and medical equipment that are instrumental in providing care. Meanwhile, process refers to the measures undertaken in delivering care, such as consultation, where the provider and patient can communicate. Finally, outcomes are the effects of the said measures on the overall well-being of the patient. The Donavidian model does not only focus on the outcome, but also given importance to the process of care. It is acknowledged that improving structure would improve the process, and this would eventually improve the outcomes. Using this theory, I would attempt to assess the effectiveness of diet and physical activity in preventing the progression of prediabetes and diabetes. The structure part here points to the nurse practitioner who would be implementing and mostly monitoring the effects of the lifestyle intervention on the participants. This also includes the blood test and weighing scale, or the tools that would use to gather concrete evidence that there is actual progress. The process part is the implementation of a lifestyle intervention, where the patient would be required to do physical activities and follow a diet plan. Lastly, the outcome part of the desired result, which is a drop in the patient glucose levels in weight. This is a step toward the prevention of prediabetes and diabetes progression, and also a free alternative to metformin therapy. As I have mentioned earlier, the primary stakeholders of this DNP project are the patients and the providers. On one hand, the patient are the main beneficiaries of the DNP project, and at the same time, they provide information that can be used for the improvement of existing or future studies on healthcare. Since we will be collecting data from them, It is important that we secure their consent for established trust and inform them for the nature of the project that they are going to be participating in. It is also important for the patients to be educated on self-management, especially regarding exercise and food intake because these are directly related to blood glucose levels. Moreover, it is also necessary to inform them about the symptoms and complications of diabetes, which could help them understand the severity of the condition. Therefore, obtaining sufficient knowledge about this could help motivate them to take self management seriously. On the other hand, the providers could serve as the main support of the patient. Part of the responsibility is to guide the patients through the consent process before joining the project. It is important to keep the consent process comprehensible to the patient, and this includes focusing on disseminating information that is most relevant to the patients without bombarding them with jargon, clarifying the objectives of the project, explaining the nuances of patients' participations, and being honest about the risk of the project. Conducting interview could also help providers determine the patient insight, personal situation, and medical history, which could potentially reveal narrative about the experiences of minorities that are rarely talked about. The information gathered from this interview would help the providers understand the perspective and the need of the patient, and it could help them adjust accordingly so they could give the support that each patient needs. In connection to the Donabijan model, the structure and the form of providers could play a vital role in providing support and information to the patient. Educating the patients about the project and self-management and gathering patient information can also be part of the process because those are measures initiated to ensure that the patients would feel safe should they agree to become a participant. The progress from these first two parts could then affect the outcomes. The goal of this DNP project is to replace metformin therapy with diet and physical activity in preventing the progression of prediabetes or diabetes. In order to do this, I have to convince the diabetic patients from Tri-City Medical Group, my chosen affiliated clinic from Compton, California, to be willing participants in my project. As discussed earlier, this would include an intensive explanation of what the project is about and also getting to know the patient personally to find on their opinion and concerns. Once I already have 30 participants, I would begin by testing their glucose levels with an HbA1c test. This is used to see if a person has prediabetes and or diabetes, and this could also be used to monitor glucose levels. Throughout the duration of the project, the participants would take the test a total of 3 times to monitor their glucose levels have fluctuated since the beginning of the lifestyle intervention. Other than this, their weight would also be regularly monitored. Excess weight, especially obesity, can increase the risk of getting prediabetes or diabetes. So it is important to monitor the body mass index, which is within the normal weight range. The nurse practitioner will implement the diet plan and workout routine. Although there are many types of physical activities that are said to reduce the risk of getting prediabetes or diabetes, I opted to settle with walking and stretching because they are relatively easy to integrate into everyday routines and have no cost. Moreover, if there are patients who are suffering from diabetes complication, this type of physical activity would still be safe for them to do. Although the nurse practitioner would oversee the entirety of the project, the participants would be encouraged to self-monitor with the use of a lifestyle journal. In this journal, you can just jot down the results of their HbA1c test every 3 months, their weight change, meals for the day, exercise regimen, and other information relating to their health progress. Self-management is important because it heightens the patient awareness and engagement with their health progress, which means that they can make active decisions and helping themselves grow healthier. That ends my report, and I hope you enjoy listening. Thank you.